the licensed professional counselor by our group with Miss Crampton, Mr. Foster, Miss Clayton, and Miss Toothaker. Rebecca, can you tell me what do I have to do to get a doctorate in psychology?
Great question. So the KCREP offers standards for the doctoral degree. Prior to entering the program, you must demonstrate academic aptitude, professional experience, as well as self-awareness in your own psychological journey, oral written communication skills, cultural awareness, and a multicultural background, and professional leadership prior to entering the program. You must have a minimum of 48 semester hours or 72 quarter hours in the coursework through your approved organization. Um, as well as establish and work with the approved doctoral committee that you will help develop. And this committee will help you develop and complete your program, including completing the dissertation research. As the doctoral program is very heavy on the research side, as you're developing your own inquiry and new knowledge base. In addition to completing the coursework and the dissertation, you also need to complete your practicum of a minimum of 100 hours with weekly supervision and complete 600 internship hours with weekly supervision. The supervision can be one-on-one or in a triad relationship.
Wow, Rebecca, that sounds like a lot of work. Why would I want a doctoral degree?
So having a doctoral degree is incredibly helpful in extending the knowledge base of the profession through scholarly inquiry and generating the new bodies of knowledge. Not only that, but through the doctoral degree, you'll grow in your ability to publish and present such results in inquiry, and you'll be equipped to assume positions of leadership within the psychology profession, and further psychology as a profession. You can also gain a scholarly examination, integration, and conceptualization of theories for clients, and overall create new theories or help with furthering integration of those theories, as well as learning more methods for evaluating the counseling effectiveness and ultimately serving the clients. So as you're gaining more education and knowledge and ability to gain and search for new knowledge, you're able to serve clients more. And that's really the purpose of counseling, is to serve clients and help them through their own mental health journey.
Wow, that sounds great. What would it cost me?
Awesome. The financial benefits and costs. When you are getting a master's degree, for instance, the median salary is 45,000, whereas the maximum is 100,000 per the national averages. However, if you were to get a PsyD, which is a doctoral in psychology, you could have an increase of $15,000 per year in salary or $30,000 per year in salary. Doctorate in philosophy, a PhD, is another increase 3,000 on average, or an increase 10,000 for the maximum. So there is a bigger salary that is offered, as well as being able to help more clients and being able to expand your clientele. However, with those benefits, there is some costs that come with the median national anticipated debt load, not necessarily including interest. The PhDs start at about $75,000, and the PsyDs at $160,000. So as long as the cost is reasonable and those benefits increase salary, as well as being able to help more clients and increase your clientele capacity, a doctoral degree is very beneficial despite those costs. So, Sarah, what are the licensing requirements for licensed professional counselors?
According to American Counseling Association, all states require licensure applicants to obtain a master's degree in counseling. Most states require individuals to complete 60 semester hours of graduate studies, including at least 48 semester hour master's degree. All states require that counseling graduate programs be accredited. The Council for Accreditation of Counseling and Related Educational Programs, CAC REP is an independent agency recognized by the Council on Higher Education Accreditation, which accreditates master's degree programs in mental health counseling and other counseling specialties. Several states require that licensure candidate counseling graduate's degree include a curriculum based on CAC REP model, even if full accreditation by the CAC REP is not required. CAC REP accredited counseling programs require coursework in 8 core areas and supervised practicum and internship.
That's awesome, Sarah. So what is the required length of supervised practicum and internship, like you mentioned, and what tests must be passed to gain licensure?
Applicants for licensure must obtain a minimum amount of supervised experience before being licensed. Hours of supervision fluctuates between states. Most states require individuals to accumulate between 2,000 and 3,000 hours of supervised experience and a number of face-to-face supervision hours within an allotted time frame. In the state of Tennessee, a counseling applicant is required to accrue a minimum of 2 years of counseling experience with at least 1,500 hours of direct client contact, 1,500 hours of clinical work, and 150 hours of supervision. Every U.S. state requires licensure applicants to pass a comprehensive examination on counseling practice. Not every state uses the same test, but the tests that are used are National Counselor Examination, National Clinical Mental Health Counselor Examination, Certified Rehabilitation Counselor Examination, Examination of Clinical Counselor Practice. Some states, such as Tennessee and Colorado, require applicants to pass the jurisprudence exam.
Wow, sounds like a lot of very important requirements. What are the ongoing requirements for LPC licensure?
Licensure renewal for LPCs must be done every 2 years. In the state of Tennessee, professional counselors must complete 20 hours of continuing education with at least 3 hours in ethics or Tennessee rules and regulations during each 2-year period. In the state of Colorado, an LPC must acquire 40 professional development hours in line with their learning plan. So, Rodney, can you explain the history of the counseling profession?
Well, thanks so much, Sarah, for asking that. Although the roots of this counseling profession are far-reaching, the 1800s actually provided the cornerstones as it relates to modern-day counseling. You see things such as testing, vocational guidance theory, and the humane treatment approach. They all developed from the reform movements, and they were crucial elements involved in the formation of the counseling profession. If you go on, additionally, in the 1800s, Dr. Sigmund Freud and his theory of psychoanalysis, that ushered in this new psychological way of viewing the development and the treatment of the person. And that new theory had a major impact on the emerging field of counseling that we even see today. As we move on into the 1900s, we see the important work being introduced of Frank Parsons. Now, Parsons was this founding father of the vocational guidance counseling in the United States. As a matter of fact, he established what was called the Vocational Bureau, and he laid the foundation for the profession of what we see as the modern-day school or guidance counselor. Parsons' work paved the way for modern-day counseling. He could even be seen as one of the true founders of the counseling profession. As we move into the 1930s, we see a kind of the greatest leap in the emerging counseling profession as E.G. Williamson. He developed what is considered to be the first comprehensive theory of counseling, and he employed the use of analysis, synthesis, diagnosis, counseling, and the most important thing about it is he included follow-up with the client, which we've all learned is incredibly important. Additionally, the 1930s and the 1940s saw the rise of Carl Rogers and his humanistic, client-centered approach to counseling. Now, as we move into the 1950s, that brought a barrage of changes and developments in the field of counseling. We see that the 1950s witnessed theoretical advances in career counseling, as well as child development and lifespan development. The 1950s also experienced a major increase in school and college counselors, And we see that community agencies also saw an influx of counselors and psychologists during the 1950s. Also in the 1950s, we witnessed this formation of several professional counseling associations, all of which I'm not going to mention because they're right here on the slide, and it's an incredible amount. But also we see that there was this need for counselors and other mental health professionals, and expanded as a result of the passage of many legislative actions related to President Lyndon B. Johnson. In the 1960s, we saw continuing work in the counseling field. And then in the 1970s, we see legislative actions that kind of led to further diversification in the counseling field and resulted in large numbers of counselors settling into the mental health, rehabilitation, higher education, and school counseling specialty areas. Now, the 1980s and all the way through the 2000s, we continued to have witnessed this expansion of diversification in the field of counseling, as well as an increased focus on ethical standards that we've all learned about. And also, with the profession clearly of coming of age, it became increasingly evident that there was an urgent need for standardization of training and the credentialing of counselors. Therefore, in 1981, which we just heard about, the CACREP was formed to further delineate standards for the profession. Now, in 2021, where we are today, the impact of multicultural and social justice issues seems to be indicating that we're in this new paradigm shift, a shift toward more inclusiveness, an increase in understanding of difference, culturally competent counseling, advocacy work, and really a new type of counseling that doesn't always take place in the office. So needless to say, thank you for the question, but we can tell that counseling has a rich past and a very exciting and bright future.
So who are some of the prevalent pioneers of the counseling profession?
Well, thanks again, Sarah, for that question. If you take a look at this slide, you're going to see that there were quite a few, beginning with John Dewey. First of all, John Dewey was an education reformer who advocated for humanistic teaching methods. We go through Alfred Binet and Jane Addams, Emil Kraepelin, and then we get to Pierre Janet. And Pierre Janet saw a relationship between certain psychological states and organic disorders. Then, of course, we've all heard of Ivan Pavlov, who developed one of the first behavioral models of learning. We continue on with some of the pioneers, which are William James, Eli Weaver, Jesse Davis, Anna Reed, Frank Parsons, which we just learned about, which was the founder of vocational guidance, Clifford Beers, E.G. Williamson, John Brewer, and of course, Carl Rogers. These all were pioneers in this incredible field of counseling. So, Tiffany, in practice, what do I do in an ethical dilemma?
You know, that's a really great question, Rodney. And I'm really glad you brought up the formation of the American Counseling Association in the 1970s. That would be our go-to. That's our ethical code. If someone wants to, if they're a farmer and they don't have the funds or the insurance, but they have a cow, they might approach you and say, hey, can we trade some livestock or something like that? And how are you going to handle that? Well, you're going to go to the American Counseling Association and find where it talks about bartering, and you'll find that that is okay if that is something you're comfortable with. Secondly, if it's just not in there, if it's a gray area, you're going to want to go to your supervisor. And this is really important when we first enter the field. As Rebecca and Sarah covered, we're going to have those supervisors right when we first enter, and they're a really great resource for us. And then, of course, we can go to our former professors. I think they're all rooting for us and want to see us succeed. And if for whatever reason, I think we've heard in our interview, she had that issue and she really leaned on her former professors. And I think that really brings light to a good resource. And then each other, our cohort. And again, the educational requirements, we're going to be together for a few years and learning from each other. And so we can always go back. And then, of course, as we grow in the field and participate in the networks of other therapists, we're going to find people that we trust and can rely on, and we can ask them as well. So if there's any ethical thing, go do your research in the ACA, then your supervisor can ask your former professors, cohort, and eventually your therapists.
Great. Thank you so much. Just have another question. Tiffany, why do I need a membership to an organization?
Well, that's a really great question. And really, to answer that, we need to look at the benefits of what an organization will do for us as LPCs. So, the ACA, for example, it has job resources where after we graduate, we can go there as a job seeker, and it can connect us to employers seeking employees. We have access to the research articles and the publications. I think we are going to be very accustomed to being able to just go to our library and look at that. But when you sign up, you're going to have access to these journal articles and all the new research that's coming out all the time. I mean, as we can see through the pioneers and what they did, and it's always growing and evolving. So that's a really key factor in having the membership. And then it helps us keep track of our continuing education requirements that we've covered here. It's just kind of that one-stop shop where you can go there, sign up, take your classes, and just know that in that one area you're handling that, and you won't invalidate your license by not continuing your education and meeting those requirements. And then it also, another one specific to the ACA is the awareness of government affairs. The policies and everything that impacts the ethic code and the regulations, that's all of there too. And we can kind of get a heads up when things are coming our way so we can prepare ourselves, which I think is important when we're in the field. And then again, memberships are customized towards specialties. So for us, our LPC, the ACA is great for us, but they also offer different specialties, such as a school counselor, career counselor, or clinical professional counselors. The difference between those are the research articles and publications. You might need to know a little more about one thing than another thing. So they kind of just cater to that specialty. So the ACA really is a great resource for our LPC, and you can see how it hits all the marks of the education, our licensure. You can see how the history came into it with the ethical code, and it's our go-to. And it's just a really great resource that sums it all up.